everyone, and happy Tuesday. We are going to be talking about stress relief again. We've been talking about stress relief a lot, especially during COVID times. But today, what we want to do is we want to talk from a Chinese medicine perspective. Talking with Dr. Paige Yang, who's joining me live from Hawaii. And Dr. Paige will be joining me. Oh, there you are. Welcome.
Hi.
How are you?
Good. How are you?
Good. Perfect timing. So I was just telling the viewers about our topic. We're going to be talking about the stress relief, specifically, from the Chinese medicine, from plus diet and the breath work. And I was just introducing you, Dr. Paige Yang. She is a licensed acupuncturist with doctorate of Chinese medicine who specializes in women's health, emotional health, and facial rejuvenation. We are going to be coming to the facial rejuvenation in a week or two. And today, do you like to add something, Dr. Paige, about yourself before we start with the questions?
I think that pretty much covers it. I've been in what we call TCM, which stands for Traditional Chinese Medicine. So I've been in the TCM world for 10 years. And I have two practices, one in Hawaii, one in the Bay Area. As you mentioned, I have both my master's and my doctorate. And I'm really passionate about empowering my patients to really be their best doctors and take care of themselves. So, yeah, thank you.
Right. Great. So let's talk about how can Chinese medicine help with stress relief and what are the different tools that you are using in your practice?
Yeah, this is a great question. So I always say that 100% of my patients that come in have underlying stress. So whether they're coming in for fertility support, for, like I mentioned, the facial rejuvenation, weight control, helping to balance hormones, all of them have underlying stress. So traditional Chinese medicine includes a lot of modalities. The main ones that people recognize are going to be acupuncture and Chinese herbs.
Yeah.
And these are the two that I utilize the most in my practice. So, yeah, and acupuncture. So what's wonderful about acupuncture is we all know and we all talk about this kind of fight or flight response, right?
Yeah.
And we hear people that say, oh, well, stress was a really good thing before when we needed those hormones to survive attacks or, like everyone talks about that bear attacking you or trying to survive that, right? Yes. But then back then when the attack was over, our body understood that and returned to homeostasis. But right now what's happening in our daily lives, we're going throughout our days with this kind of underlying chronic stress. Yeah. Sometimes it's low grade, sometimes it's very intense, but we're never letting the body return to normal. We're never giving it a chance and signaling it to say, the attack is over, you can calm down now. So what acupuncture does essentially is it gives the body those messages. It gives the patient that time to know that they can relax. They're no longer needing to be in the fight, flight, or freeze. Yeah. And it really works on the HPA axis, right? So that's the hypothalamus, pituitary, adrenal axis, and helps to slow down the release of the stress hormones so that the body can return to normal, be balanced, and release some of that stress that carries them day in and day out. Yeah.
No, absolutely. And I mean, I have gone through acupuncture so many times, for different reasons. So what I wanted to also, if you can expand a little bit more, you talked about the Chinese herbs, and someone made a comment right now that acupuncture is very similar to Ayurveda. Ayurveda is also 5,000-year old medical system. That's probably true. That's true, right? So how do you combine the diet and the breath work, with the Chinese herbs and the acupuncture? So sort of like, let's talk a little bit about that, the correlation of everything together.
Okay, great. So I'll kind of piece them out first so that it's clear. And then after that, I'll bring them all into how they're interconnected. So for the Chinese herbs, I mean, primarily we see, when I see people come into the clinic, a lot of them that are coming in with stress have what we call in Chinese medicine liver qi stagnation. Okay. So when you're under stress, it inhibits the free flow of your qi or your energy. that flows in the meridians, that just kind of like our energy highway, right? And so these herbal formulas work really well at releasing the blockages of those energy pathways in the meridians. And they're going to help release the stress there. So most of the herbal formulas that I work with are targeting this liver chi and helping to smooth it out. So there's that part. And then in terms of diet, a lot of things within our diet can also block our energy and our chi, right?
Yeah.
So sometimes some patients need really detailed hand holding where we kind of piece out, okay, we're not going to eat this, we're going to eat that. We might do some allergy testing, look for food sensitivities, and see what might be what might be causing histamines to go up in the body and so forth. Or if patients are more in tune with their bodies, we'll kind of just do something where it's like a body aligned diet or a heart aligned diet, where if they feel like they're having a negative or adverse response to the food, then we just won't have them eat it. But if it's advantageous and it's helping them get through the day, then they'll eat it. So that's what diet can look like. And then in terms of breath work, under traditional Chinese medicine and under, Chinese culture and history, we have these two practices, one being Qigong and the other being Tai Chi Chuan, which is also known as Tai Chi.
Yeah.
So Tai Chi is more of a martial art, and it's free flowing and fluid. And then Qigong is more based on, there's a lot of different types of Qigong practices that can kind of be broken up to address specific things. But both of these practices really work on this mind, body, breath as pillars for relaxation. So in my practice, I will always utilize, all of these things like you mentioned, and kind of send patients home with homeworks and see where they might be lacking. Is it the diet? Do they need to take the herbs? A lot of times we say, when you come to an acupuncturist, you're seeing a trainer. But when you go home and you do the homework and you take the herbs, you're doing your actual home workouts, right? Because it's something you can do for yourself every day. And then, of course, as you recognize in both of the medicines that people talked about, Chinese medicine and Ayurvedic, is the food being medicine too, right? So you have opportunities all day to medicate yourself. And this is something that we just need to relearn or remind the patients of. And then again, bringing in the breath as a detox, right? So we have detox with sweating and urination, bowel movements, breastfeeding, but breath is really the number one detox, right? It's yes. So this is another thing that I remind patients to do as well, to always be mindful, intentional, present, easier said than done. And they can utilize these practices like Tai Chi or Qigong to really encourage being present with the breath and the mind and the body.
Yeah, no, I think that makes complete sense. I mean, that's exactly what yoga says. Similar thing, right? Yoga is also the same thing, and there's so much research that's already been done that's associated with the breathing, the breath work, with the, relaxation of the mind. So let's talk a little bit about the Chinese formulas. Can you share a couple of formulas with our viewers which help?
Yes. So there are some, like what we might call empirical formulas that are very popular. A couple that I love and I always go to because I work with, primarily women, is a formula called Xiao Yao San. And this it's often translated by some pharmaceutical companies as like the free and easy wanderer. Okay. So this is a great formula to smooth the chi while also boosting your chi. Because, when you're under a lot of stress, it's energy draining as well. So this one's really popular. Another popular one is going to be Chai Hu Shugan San or Shugan San. So Chai Hu is the particular herb, and it can be added or not added. And again, this one is great at moving the liver chi, but it's also wonderful at moving blood stasis or blood stagnation. So as we know, the liver stores the blood.
Yeah.
And when the chi gets really stagnant, it can also stagnate the blood, right?
Mm-hmm.
Particularly if it's affecting the liver.
Mm-hmm.
So this formula is a little bit stronger because it's going to move the blood as well that was stagnant. So I prescribe this formula a lot for women that have dysmenorrhea or painful periods, that they might have like clotting, dark bleeding, those types of things in their cycle, and maybe even some mood disorders related to their menstrual cycle.
Yeah.
So that's when I'm going to use that formula. So those are the big ones. And then many of the formulas will kind of come off of those formulas depending on what else they might be presenting with in the clinic.
So these formulas, are they liquid form, or you have to take a capsule? I mean,
So they come in different forms. The strongest form is going to be the raw herbs. And this is the really pretty formulas that you might see, where you see like roots and shoots and flowers and berries. So that's going to be the most powerful, but it's quite time consuming. You have to cook it and boil it. And then there's going to be powder form. And the powder form is these companies kind of do that process for you. Yeah. And then they process it into a powder. There's also encapsulation. Well, they'll just encapsulate the powder. And then there's these pressed tea pills, which are those teeny, like dark balls. Okay. And those are the most convenient. You do have to take quite a bit of them because they're very little, but it's something that patients, I tell them I'd rather you take the herbs versus not taking the herbs. So if it means that you're going to have a method that's a little bit more diluted and not as potent, it's okay as long as you're taking it. So this can come in like a pill bottle, that form, and they can throw it in their bags and take it when they remember throughout the day, or when they're at work, or when they're commuting. So those are the main forms that I'm working with and that our medicine works with.
Got it. I think and acupuncture, I mean, I've been doing regularly, not during COVID, of course, but I can, I try to go every couple of months to exactly do what you're trying to say, to calm myself, to cleanse, it's a great cleansing and helps me calm down. So it's absolutely great. I haven't been doing too much herbs along with it, but I think this is really great what you were talking about.
Yes.
Yeah. So what would be, let's say, someone who is stressed out, which most of us are right now, some form or the other. So what would be the standard routine that you would recommend? Acupuncture, we can't do it every single day, of course. We can do it once a month, or, however the time, permits. What would be your daily routine that you would say?
So I think it will first depend on the amount of stress that the patient is under, right? Yeah. So if a patient is coming in with severe, more like acute stress, where they're having anxiety attacks or panic attacks, or it's debilitating in some capacity, then I'm going to have the patient come in as often as they're able to. So it can be twice a week to get over if they're having extreme panic attacks, or they're not able to drive or go to work, those things. But I have them rated on a scale of 1 to 10. So, or 0 to 10 even. So 0 is no stress and 10 is full panic attack, right? Yeah. So if they're maybe then a little bit less, so not at that, what I just described, this like panic attack debilitating, but if they're kind of at like a 7 or 8, where they're really under a lot of pressure, I'll have them come in once a week. For 3 to 6 sessions, but typically they're going to need more than the 3. And I send them home with an herbal formula that they need to take every single day for those 6 weeks. And then the nice thing with the way I practice is they have my email. And we can communicate there. I'll just check in with them. How are the herbs going? How's your routine? And all of those things. So that's what it will look like. And then someone who has kind of just the everyday low grade that we all have in this modern world, like you said, they can come in once a month to touch base and see where they are. If things spike up for them, they can come in more than that. So I just meet the patients where they're at, and I guide them as best as I can, and then how they can see fit in their schedules, their time, and their finances, then we'll work within that framework.
Got it, got it, got it.
Yeah.
And then you also would recommend like a daily breathwork routine, right? With whether it's Tai Chi or Qigong, and then the diet that goes along with it to calm one person.
Right.
Or someone.
Absolutely.
Yeah.
So sometimes like Tai Chi and Qigong, it can feel like a big commitment because it's a lot of learning that needs to be done.
I see.
And I feel like so I'll teach them small exercises when they're coming into the clinic. And it's most of the time it's a Qigong exercise.
Okay.
Because like I said, there can be kind of short, isolated exercises. There's one that I love that's a shaking, where you just stand, hip width apart, knee soft, and you just shake the body. And this is going to loosen up the stress that is so tightly wound up in the body.
Yeah.
And it's gonna force you to, I also have them visualize releasing the stress, letting the stress out of the body, and so forth. And this is a really simple one. I personally too, because yoga is very popular in the West.
That's right.
I'll often prescribe yoga nidra.
Yes.
Because I feel like this is one of the fastest ways to release stress from the body. And it's very, I just say you just have to lay down and listen.
Yeah.
So this is another thing that I'll utilize. Even though it's not traditionally under the TCM framework, yoga in general is just a little bit more, everyone has, for the most part, a lot of people have experience with yoga here, right? Or the ones coming in to see me. Yeah. So if the shaking feels awkward to them or some other exercise that I give them, then I'll say, you know what, just look into this practice and see how you do with that instead. And
No, yoga is thanks to Lululemon. I think yoga has gained so much popularity. Just making it very glamorous. I think in the US right now, and most of us have experienced yoga for sure. And so, I think that's great. Anything else you'd like to add before we wrap up?
No, I feel like those are great questions. And I guess I would add, and what you're kind of getting to too, is that we should all not underestimate the power of our breaths. Yes. And how it instantly makes us present, instantly grounds us. And what I tell my patients too is I say, what is the one thing that's consistently different when you're stressed versus when you're relaxed? Yeah. And that's their breath.
Yeah, yeah.
Right.
So is there a special exercise for the breath that you would recommend? I know yoga enough, but I don't, I've done a little bit of Tai Chi, but is there a special exercise you'll say breathe in, breathe out, or something like that?
Yeah. So the easiest that I say is breathing in for 3 seconds.
I see.
And then breathing out for 4.
Okay.
Yeah. Okay. So we're gonna, when you exhale for longer, it's going to help get that parasympathetic, that rest and digest, more into gear over that sympathetic fight or flight. Yeah, that's the simplest. And then I also tell patients that might have bad anxiety to look around and actually just say what they see. So if they just say the sky is blue, the trees are green, the bed is soft, and that's just like a very simple, basic way to drop them into the present moment, where they don't have to jump onto some kind of ideology or practice. They just have to name things around them, and that's going to help them as well. So
be in the present and don't think of the past and don't worry about the future.
Yes.
Which all of us do. We can't let our so someone talked about where can we get it? I think they're talking about the herbs or something.
Yes, the Xiao Yao San. So that formula has become so popular that a couple brands, the big one that I'm thinking of is called Plum Flower, and they carry it in Whole Foods.
Whole Foods as well? Wow.
Yes, and I'm probably some other smaller local health food stores.
Okay.
So it's called Xiao Yao San, or I'll type it in here, or Free, and it's also been known as Free and Easy Wonder.
Free and Easy Wonder. Okay, Xiao Yao San. And it's safe to for us to go take it and take it a little bit. I don't know what dosage.
Yeah, that's a great question. So I would prefer, of course, it's really important since it is a
Yeah.
pharmaceutical to take it under the supervision of a licensed acupuncturist, and they're
Yeah.
also going to be able to tailor the formula for you. For the
Okay.
most part, it is safe and it shouldn't do too much harm, but it's important to know medications, like if there's blood clotting issues, hypertension, those things. But otherwise, yeah.
Okay.
I think
Yeah, no, I think this is great. Anyone else has any feedback or questions, you're welcome to type it in. And if you can't think of the questions right now, I'm just trying to see the feed. You can DM us as well, after the video is done, and we'll be happy to, take care of the questions. We will be, okay, someone said, thank you. You're welcome.
Yeah.
And we are coming back, again with Dr. Paige. I think it's next week. The topic is absolutely fascinating. It's facial rejuvenation. I think a lot of women would be interested in, even men for that matter, would be interested in joining that. So stay tuned. We will let you know. With that, I'd like to wrap up this session. Thank you so much, Dr. Paige. I can see you're in Hawaii. I can see the beautiful greenery.
Yeah. Thank you so much for having me. It was a great discussion. I hope it was, I hope everyone, it was easy to understand. So, but I appreciate the good questions too.
It was very easy to understand, and thank you so much, and enjoy your day. Thank you.
Okay, you too. Bye.
Bye-bye.